Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers community nursing concepts. Specifically, we're going to talk about the RN in the community, dealing with cases, programs, and disasters. By the end of this lesson, you should be able to distinguish continuity of care, care management, case management, and advocacy. You should be able to describe the scope of practice and roles for functions of an RN functioning as a case manager. You should understand the nursing process with case management. You should identify and manage how to manage conflicts. You really need to be familiar with the different case management roles that are listed here. You should be able to understand program planning and planning process for those. And we will also discuss disasters. Those are going to be important for you to understand as far as types of diseases, including natural disasters, human-made disasters, and you should be able to evaluate the effects of disasters on people and their communities. And you have to understand what we call the disaster management cycle. And you should be able to understand what happens in how you can be involved with organizations that respond to disaster. Okay, let's talk about what RNs in the community do with community cases. One of the important roles of an RN in the community is to act as the client advocate. So the goal of advocacy is to promote client self-determination. Remember, it's about the client. We're advocating for them. We want them to have an ability to take care of themselves better. When you're performing in an advocacy role, you're going to have conflicts that emerge between how much you got to give, how much information you got to give, territoriality, accountability issues with different parties and disciplines that are involved in it. You may have some legal challenges for clients' decisions, and you may have to compete for resources that are not there. So the functions of advocacy and allocation can pose a lot of dilemmas in a practice for a nurse. Skills that are important in being a good advocate is having a helping relationship with people, being assertive, and being a problem solver. Those are things that are going to help you be a better advocate. Problem solving. What is problem solving? Problem solving is a systematic approach that includes understanding the values of each party in generating alternative solutions. What are things you can do to be a better problem solver? Brainstorming is an example of a technique you can use. A problem purpose expansion method is another way you can go ahead and use a technique to help with problem solving skills. It's important that a nurse that's functioning in the advocate role understands that we're trying to promote the client's self-determination. We're going to discuss more about what a nurse does as far as in care management or case management. Care management is a strategic program to maintain the health of a population enrolled in a healthcare system. Continuity of care is a goal of community health nursing practice. We know that it requires making linkages. You have to make linkages between services to improve the client's health status. As you can see in the picture that's surrounding here, as the structure of healthcare system moves towards delivering more community health services, you know that continuity of care is going to be a greater challenge. So the case manager typically is an interdisciplinary player. They look at the process from an interdisciplinary standpoint, with the client being the focus, okay? Documenting case management activities is important. Documenting outcomes is essential for community practice. A case management is a process that takes a nursing process, so you assess the needs and you plan the needs, you coordinate services, you do referral monitoring, you evaluate the practice. The nurse functioning in this role advocates and as well, and also is very aware of the ethical and legal issues of their practice. Okay? They usually have a standardized standard of care for a lot of the predictable outcomes that happen, and they use critical pathways, they use disease management protocols, and they may use a multidisciplinary care plan that they follow for different standardized care pathways that are established. Okay? Let's define a few terminology that you may hear that's important for you to just be aware of. The first one is use management. Use management attempts to redirect care and monitors the appropriate use of provider care and treatment services for both acute and community and ambulatory services. So use management, the nurse is going to look and monitor the use of treatment services in providers. We talked about critical paths. Critical paths are tools that are that name activities that can be used in a timely sequence to achieve a desired outcome for care, and critical paths strive to reduce the differences in client care. This is important for us to understand that we're just not going to guess what needs to happen for one client over the other. Disease management, as a definition, are activities targeting chronic and costly diseases that require long-term interventions. Example is diabetes. So those are going to be referred to a case manager that focuses on disease management. So strategies to address the cycle of the disease process, and they may have different interventions that approaches they may use. They may do primary prevention. They may do some secondary prevention. They may also do some tertiary prevention, which you're very familiar with this terminology now. They may also have the patient perform more self-care activities. Okay, let's talk about demand management. Demand management seeks to control by providing clients with the correct information to empower them to make healthy choices using health and health-seeking behaviors, okay? And that way they make fewer demands on the healthcare system, okay? So demand management intervenes specifically, like an example of that is Medicaid programs that target high-costing chronic diseases such as asthma and diabetes. Okay. Let's talk about telehealth in case management roles. We're going to know that there's going to be tools that are going to be and applications that are going to be essential to the well-functioning of a case manager. And another thing you may hear is a life care plan. A life care plan is typically used for clients experiencing a catastrophic illness or adverse events that resulting from like a malpractice. Others who benefit from life care planning are those that are sustained an injury when they were younger and they have completely, whose care requirements have changed as they have gotten older. They may benefit from a life care plan. Okay. Why doesn't every community client have their own case manager, you may ask? Case management is very time demanding. It is restricted to complex cases. It is labor intensive. It is time consuming, and it is costly, but it's very beneficial, okay? Because of the increasing number of clients with complex problems, nurses' caseloads and intensity and the length of activities required to support them have put a lot of demand on healthcare. In moving along, we're going to talk about the RN and community programs. Planning and evaluation are essential elements of program management, and they are vital to the survival of the nursing discipline and healthcare delivery. A program, as we call it, is an organized approach to meeting They assess needs of individuals, families, communities, and reducing or eliminating one or more health problems. What are we saying here? A program is going to come in and meet the needs that we have identified in assessment. So a program is going to serve as an intervention. The comprehensive goal of a program planning is to ensure that healthcare services are acceptable, that healthcare services are equal, and healthcare services are efficient and effective. So those four things. We want things to be acceptable by the community that's receiving them. We want to promote equality, and we want to make sure that the nurses in the community are efficient. Okay. So what is program planning? Planning is defined as selecting and carrying out a series of actions to achieve a stated goal. Evaluation is defined as the methods used to determine if a service is needed and will be used. Whether a program meets that need and is carried out as planned, and whether this service actually helps the people it is intended to help, that's going to be addressed in program evaluation. A very important aspect of nursing care that we need to cover is the RN and disasters. The number of disasters, both human-made and natural, are increasing, and as does the people that are affected by them. The cost to recover from a disaster has risen sharply, and this is because of the amount of technology that must be restored after a disaster. And we as nurses in the community know that professional preparedness is going to be important on our part. And professional preparedness involves an awareness and understanding of the disaster plan at work and in the community where you reside. So here's a question I have for you. Do you know what that plan is for your house or your community as far as many aspects of disaster are concerned? Nurses are increasingly getting involved in disaster planning, disaster response, and disaster recovery as they should. And they should be involved both at the local health department and the local government level. Okay? Disaster opportunities that await them in a disaster incident involve disaster prevention, disaster preparedness, and disaster response and disaster recovery. We will discuss this terminology in the next slide and kind of connect it together. It's important that you understand what's available as a nurse as far as disaster. You need to be able to help your clients maintain a safe environment. You need to advocate for environmental safety awareness measures in your role as an RN during all phases of disaster management. We'll talk about phases of disaster management. Okay, another thing I want to stress is that people in the community will react differently to a disaster depending on the type of disaster, the cause of the disaster, the location of the disaster, and the magnitude and extent of the damage. Okay, we also want to know how long the disaster is going to last. People get tired, and the amount of warning that was provided prior to it also plays into that. Okay? Other ways people act differently to disaster is going to be based on their age, their cultural background, their health status, their social support structure, and general adaptability to crisis. The same way when a patient is involved in a car wreck, the injuries and the level of response, the human body response, differs from one person to another. So every component of the community as our client is going to be different. Okay? The stress of nurses is compounded if they are both the victim and the caregivers in a disaster. So nurses have a role to play, but they may have a harder time because when a patient is sick, it is not our body that's sick. But when a community is sick, nurses are also part of that community. So disaster shelter nurses are exposed to a variety of physical and emotional complaints, including stress that they must deal with their own self and their family. Okay? The stress of a disaster may be instigated by shock, the loss of personal possessions, the fear of the unknown, the living in proximity to strangers, and the boredom that follows disaster cycles. Okay? The degree of worker stress in a disaster depends on the nature of the disaster and their role in that disaster. Okay? And also how well they cope with things and other things that are listed there. Worker stress is something that we need to make sure that we're aware of when we're responding to disaster. And also, a big key attribute to victims of disaster is being able to be flexible. Let's expand more on this. Let's talk about the disaster management cycle. The disaster management cycle includes 4 stages. As you can see here, the stages are prevention or mitigation, preparedness or preparation, response, and recovery. Okay? The first stage is prevention or mitigation. This happens before the disaster happens. So mitigation refers to actions to prevent specific disasters from occurring or to reduce the severity of disaster effects if it cannot be avoided. So it's almost looking at what are we at risk of? How can we prevent it from happening? Or if we can't prevent it from happening, what can we do to reduce its effects? The stage of disaster known as recovery, right here, occurs as all involved agencies will pull together to restore economic and civic life. Before recovery, though, there's preparation and response. In preparation for a disaster, the level of preparedness is only going to be as good as the people in the organization in the community. Although natural disasters cannot be prevented, most can be minimized in impact, and we can reduce the accidents, the death, and the destruction impact. Okay? We need to have a disaster plan to do so, and it needs to be realistic, and it needs to be well rehearsed, and it needs to have meat on it. So a disaster assembly kit would come in at this level. Let's talk a little bit about disaster response. The level of disaster response can happen at the local level with the mobilization of responders, fire department, public health, and emergency services, and some of you nurses would serve in the response. If the disaster stretches your local resources, the county or the city management, then FEMA, the federal management system, is going to get involved. They can coordinate those activities that are needed. Remember that in disaster management, we're always at one phase or the another. We're either recovering, or we're either mitigating, or we're preparing, or we're responding to a disaster. We have talked about quite a few things here. We've talked about cases, we've talked about programs in the community, and we've also talked about what we do in a disaster. But I want to introduce a concept to you that's important that you need to keep in the back of your mind. In healthcare, there's a direct link that exists between doing a good job and individual and professional survival. Okay? We don't just do what we do. We're looking at, did we do good enough of a job that people survived? So healthcare providers pride themselves when they actually save lives. Wouldn't you agree with that? Okay. Efforts to strengthen nursing practice in the community is carried out by organizations such as the ANA, the APHA, the ASTDN, and the ACHNE. These organizations form what's called the Quad Council of Public Health Nursing. So what does the Quad Council for Public Health Nursing do? These people monitor the quality of what we're doing in the community. Okay? Quality in the community is defined by the client's improvement in health status. So we're looking at the community. Are they improving? So other organizations such as the Institute of Medicine defines quality as the degree to which health services for individuals and populations increase the likelihood of the desired outcomes. What are we looking at? Okay, so as you start studying that, you're going to see terminology like total quality management, which is also TQM, or continuous quality improvements, CQI. These concepts are just concepts that give direction for managing a systems of care, okay? Whereas quality assurance focuses on the client services within the system, we have different approaches to quality, okay? Different approaches to quality. The goal of TQM and CQI is to eliminate any errors in the work processes before negative outcomes rather than waiting until after the fact. We don't want to wait until the job is done. I call these the machines of community health nursing. A lot of people think, oh, when I'm at the bedside, I have my monitor strip. My monitor is going to tell me whether my interventions are going well. This is going to be the monitor strips of whether our machines and our interventions that we're applying are not too much and that they're decreasing death and they're helping our client, our community. Thank you for listening to this lesson. I hope you have enjoyed this overview of community cases, community programs, and disasters. If you have questions about this lesson or the corresponding notes, please feel free to email me. Have a lovely day.